Thank you again for coming. My name is Tim Schatz, and I'm with Minnesota Health Insurance Network. So what brought us into the picture is about 7 years ago, Education Minnesota, the Member Benefits Department, they were receiving a lot of questions about Medicare. When the members retire, they wanted to know, what are my options with insurance? And not only was it, what are my insurance options, specifically, what are my Medicare options? And how do I navigate through this maze? Who can help? So that's where we came into the picture about 7 years ago. And we've developed some of these group plans that we're going to talk about today. Now, the group plans are offered through Humana, UCare, and Medica. So we'll talk specifically about those plans. Before we do that, I'll give you a little bit of a background about Medicare, the parts A, B's, C's, and D's of Medicare. We'll be able to go from there. Technical difficulty. Okay. So today we're going to talk about a little bit of the overview of Medicare, and then each carrier will be talking about their specific plans, and they'll have about 12 minutes to talk to you about those plans, and you'll be able to see that coming up here shortly. A little bit about our organization, Minnesota Health Insurance Network, and why Education Minnesota, the Member Benefits Department, decided to work with us. Well, we are an independent agency, so we do work with majority providers in the Minnesota marketplace. We're not just able to work with one or two of the carriers. We can bring in a whole bunch of different options for you. We do have over 25 years within the industry experience, where we've specifically done this for Medicare patients. Another thing that's important to know about us is that our job is to help you shop, right? It can be very confusing at times as to which plan's the best one for me. That's really what we're here for. We're here to help you determine which plan is the best one for you. We do also offer these exclusive group plans that are available to you and to a spouse. The reason why you're here today is because you were affiliated with Education Minnesota, you had paid dues when you're working, and you are now a lifetime member. So all lifetime members of Education Minnesota, as well as their spouses, are eligible for these group benefits. These benefits are offered, the group benefits are offered through UCare, Medica, and Humana. All right, so let's talk about Medicare. Now, it's important to know that Medicare is comprised of a couple different letters, right? This is where we get into the alphabet soup. This is where it gets to be a little bit shaky for a lot of people to understand Medicare. So first, it's important to know, what is Medicare? So here's just a general definition. Medicare is a government program developed for the nation's aged, right? That'll cover some limited services. Those services that Medicare covers are going to be some hospitalization stays, some physician visits, as well as very limited prescription drugs. Now, it's important to know that Medicare doesn't cover drugs that you pick up at your pharmacy. That is purchased through a private company. What Medicare does cover are drugs that are administered to you by a physician in the physician's office. Those are called Part B, as in boy, drugs, and that is covered with Medicare. Okay, so how do you qualify for Medicare? How you qualify for Medicare is one of three ways. The first way is turning age 65. The second way is if you become permanently diagnosed or permanently disabled, and you're disabled for 24 months or longer and collect Social Security, then regardless of age, you will qualify for Medicare. And the third way is if you're diagnosed with end-stage renal disease or have kidney failure or dialysis. So that's how you qualify for Medicare. Now it's important to know, how is Medicare divided? What are the different pieces of Medicare? So how Medicare is divided first is you have your Part A of Medicare. Part A is going to be your inpatient hospitalization services. So if you're admitted to the hospital, that will fall underneath your Part A services. Now, if you didn't have any other insurance except for Part A, you would have to pay a deductible before Medicare covered you in the hospital. And then you get your first 60 days after your deductible at no cost, and then you'd have a lifetime additional 30 days. But if you burn through those additional 30 days and you're still in the hospital, then you end up paying per day in the hospital. So it can get extremely expensive. So the reason why we work with a private company is to fill in that deductible and those limitations. Okay? Second piece of original Medicare is going to be your Part B. And Part B is probably the one you're going to use the most. Part B is going to be services for outpatient visits. So if you're seeing a specialist, right, if you're seeing the doctor, that's where the Part B services kick on. Now, Medicare covers Part B after paying a smaller deductible. And then once you would pay the small deductible, then Part B is known as the 80-20 coinsurance. That means Medicare would pick up 80% of your bill for those outpatient services. You would pay 20%. Okay? That doesn't sound that bad. But when you think about it, 20% of a big number can add up. And another reason why it's important to work with a private company to fill in some of these gaps is simply because Medicare doesn't offer an out-of-pocket maximum. So what an out-of-pocket maximum is it's a number that if your total bills for the medical side reach this magical number, and usually it's anywhere between $3,000 and $6,000, then as long as you're in the network, and as long as it's a covered service, your carrier is going to pick you up for the rest of that year at no cost, right? For those services, additional services. Medicare doesn't have that. So if you had $10,000 in Part B services, you're going to pay 20% of that. Okay, so it can really add up. So, but the important thing to know about Medicare is that you always have to have this Part A and B of Medicare. It's what I call the original Medicare. Okay, so you always have to have original Medicare, the A and the B, in order to buy additional coverage through a private company. And just to follow suit, the next letter is Part C. Part C is truly just a Medicare Advantage plan. It's one of the options. We're going to be talking about two different carriers that have these options today. One is offered through Humana, one is offered through UCare. So just additional options that are available, and it's through a private company. So there's obviously additional premium associated with it. And then we have the Part D. And Part D is going to be drugs. D is going to be your prescription drug plan. Okay? What's important to know right now is that you don't buy a prescription drug plan through Medicare. Medicare, though, however, sets the rules for the private companies. So you buy a prescription drug plan through a private company, but Medicare is in charge of telling the private companies how many different drugs they have to cover and in what different disease categories. And it's up to the carrier to determine which drugs they cover, and the drugs that they cover under your plan are called the formulary. All right, so we want to make sure that your medications show up on your provider's formulary, and that means that they'd be covered. If they don't show up on the formulary, then you're paying 100% of the cost of your drugs the entire year. So right now it's important to know that Part D is truly just for that prescription drug piece, and you want to think of drugs that you pick up at your pharmacy. Right? Because if a drug's administered in the doctor's office, once again, that would be covered usually under Part B, the medical side. So Part D is really just pharmacy drugs. So how do you pay for Medicare? This can be a challenge, right? What do I need to pay? I'm new to Medicare. Well, it's important to know that Part A, there's no cost out of your pocket. As long as you or a spouse have worked 10 years or more in your life and paid in, you paid for the cost of Part A through payroll. So when you're working, you paid through a payroll deduction for the cost of Medicare. So there's no additional cost when you decide to join Medicare. But there is a cost for Part B. So those outpatient services, there is a cost. And the standard cost for Part B is $134, and that is for 2017. The 2018 rates for Part B are not yet released. Okay? Some people may pay above and beyond this $134. And the reason they would is because Medicare has an adjustment. So they can charge you more if your income exceeds certain levels. So what happens is that Medicare is going to look at your income as of 2 years ago. So when you join Medicare, if you're new to Medicare in 2018, Medicare is going to look at your tax return in 2016. And they're going to say, did you make over $85,000 as a single? Or if you filed jointly, did you make over $170,000? And if you did, what that means is that Medicare can charge you more. So Medicare will assess a higher premium for you. Now, you can get this changed each and every year, and they always look back 2 years. Technically, what happens is Medicare does an internal audit, and they'll change that for you if they find out there was an error. But you can also trigger that audit by filling out a form that's available on Medicare.gov. And if you know that your income was higher because maybe you were working during those years and now you're retired and your income went down, it may be a good idea to get that adjusted, because otherwise you can pay quite a bit more for that Part B service. Remember, you always have to have the A and the B to buy additional. So that Part B cost is always there, regardless of whatever private company you choose. Now, Part C. Part C also comes with an additional cost, usually, because Part C is offered through a private company, and that private company will have a premium that they would associate, to buy their insurance. So there would be an additional cost for you out of pocket for a Part C plan as well. And then Part D is also usually an additional premium. Now, what's important to note, though, is that there's a spreadsheet that's available. It's a 2018 all-plan spreadsheet that is actually sitting in front of you. And what that all-plan spreadsheet has on there is a nice comparison of all the different carrier plans we're going to talk about today. It's important to know that all of those plans automatically include the prescription drug Part D plan. Okay, so Part D is automatically included inside of all of those plans. So now it's important to know, when can I enroll? When can I enroll for Medicare? Well, those of you that are turning 65 in 2018, you have a 7-month window. You have 3 months before your birth date month, you have your birth date month itself, and you have 3 months after. Now, I always encourage people to enroll at the beginning part of that time frame, because if you wait until your birthday month or after, Medicare drags their feet, and you may not get the effect that you want. So if you're turning 65, and you know that you want to start Medicare on your birth month when you turn 65, you want to start the process about 3 months ahead of time. And how you enroll into Medicare, there's really one of 3 ways. The first way is you can go to the Social Security office and enroll there in person. The second way is that you can call the Social Security phone number and you can enroll with a person on the phone. And the third way is there's actually an application online that you can fill out from the Social Security website as well. So one of those 3 ways is how you would actually enroll into Medicare. Another way to enroll into Medicare is really for those that are already on Medicare. It's really more of a time you can change the plan that you're on. It's called the annual election period. That annual election period is going to happen the same time each and every year. Now, that time is going to be between October 15th and December 7th. I always tell people, you want to think around Thanksgiving. You're sitting down at the table right before you're about to carve into that turkey. You're either thankful for your insurance or you're not. If you're not, that's when you make a change. Okay? So that's how that works. So that's a good way to remember that during that time, that's when you can make a change on the medical side or on the drug side or on both. Okay? But you want to make sure that you get that change in by December 7th. Otherwise, they won't allow you to get a January 1 effective date. And the third way is if you have a special election period. This is when you can enroll into Medicare. So let's say you're turning 65 and you're working past the age of 65 and you have insurance through your work. Maybe you don't want to sign up for the Medicare, or at least the Medicare Part B, because there's an additional cost. You can choose to skip that or to stay on your employer insurance. And then when you retire, at any time, you can join Medicare. So upon retirement about 2 months before, and even a couple months after, you have the ability to enroll into Medicare. And then you could buy a new plan at that time. That's called the special election period. So you don't have to necessarily retire, during that annual election period. You can choose to retire when you want, and Medicare will allow you in to pick up the Part A and the B at that time.
So do you decline that if you ask your case? So do you have to decline this enrollment?
Yes, if you want to skip the Medicare Part B, what happens is that Social Security, if you're drawing from Social Security, they will mail you a Medicare card in the mail. They automatically enroll you if you are drawing from Social Security. Social Security will mail you a Medicare card. If you know that you want to stay on your employer plan because you're actively employed, then you can send that card back. Sign the back and you send the card back, and then they'll disenroll you from the Part B, so there'll be no cost. So one more important thing to know is that with these Education Minnesota sponsored plans, one of the nice features is that you can enroll in these plans at any time during the year. So if you do choose a different plan and say, oh, I really want to get back into that Education Minnesota plan, don't worry about it. We'll allow you in. It's a year-long open enrollment. Now, I have to warn you, though, there could be some reasons why you may not want to enroll in the middle of the year, simply because if you choose a different plan and reach an out-of-pocket maximum, whatever you've reached towards the other carrier is not going to carry over to a new one. So I encourage you to talk to somebody if you're in that situation. You want to make a change mid-year outside the open enrollment, but you do have the flexibility, which is nice, through the Education Minnesota sponsored plans. So when you look at buying insurance, you look at buying medical insurance that works with Medicare, there's a couple options you have. And what we're going to talk about now is specifically on the medical side. So we're not going to talk about drugs, we're just going to talk about the medical portion of the insurance. What I like to do is lump these options into 3 different buckets, or baskets. Okay? So the first basket, one of your options is Medicare supplement policies. Now, with a Medicare supplement policy, what happens is that you retain the rights to original Medicare. So what that means is that when you go to see a doctor, Medicare is the primary payer. And you just want to make sure that doctor takes Medicare. If that doctor takes Medicare, whether you're here in Minnesota or whether you're in a different state, as long as you're in the United States, if that doctor takes Medicare, you're in the network, right? Because Medicare pays first. So it's not really network driven, it's more, do you take Medicare? But the reason why you can see it is because Medicare is the primary payer. So Medicare pays first, then Medicare submits the remaining bill over to the private company, the Medicare supplement company, and they fill in some of those gaps based on whatever contract you choose with them. So again, you can usually see any doctor in the United States that accepts Medicare patients, so it provides a lot of flexibility. And this is one of the only types of plans that you're guaranteed you can take the coverage with you. So if you did move to a different state and you wanted to take that coverage with you, you could get it registered in that other state. One of the things that's also important to know about Medicare supplements, though, is that prescription drugs are always separate. So in a Medicare supplement plan, the carrier cannot build in a drug portion to that. So you would have to have a standalone medical plan and a standalone drug plan. Now, we're not going to dive too much more into the Medicare supplements, simply because the carriers that we have here today, the wonderful plans that we've created through the Education Minnesota group plans, none of those are that specific type called Medicare supplements. The plans that we're going to talk about today are called Medicare cost plans and Medicare Advantage plans. So if you ever had any more questions on that, we would be a great resource, be able to reach out to it and help you compare some of those pros and cons of that type of plan. So let's talk about the Medicare cost plans. And the carrier we're going to talk today about that has a Medicare cost plan is Medica. So Medica falls within this bucket. So some of these key features of what a cost plan is, you can think of the Medica plan through Education Minnesota. So within a cost plan, how it works is Medicare is your primary payer for your Part A services. So if you end up in the hospital, Medicare is going to pay that bill first, and then Medicare is going to coordinate the rest of the bill with the private company. Okay, in this case, it would be, let's say, Medica. Okay, and then Medica will pay based on the contract that you are with them. But it's reversed if it's a physician visit or a Part B service. So if it's a Part B service, what happens is that the bill goes to the private company first, and the private company pays their portion and gets reimbursement from Medicare. So it's kind of a hybrid. So sometimes Medicare is the primary payer, sometimes Medicare is the secondary payer. What does this mean to you, the consumer? All this means to you, the consumer, is that it's network driven when you're inside your state, or the service area they call it. When you're outside that service area, then you can see any provider that accepts Medicare patients. Okay? And Stacy will talk a little bit further in detail about how that works within the Medica plan. But that's really what it means to you, the consumer. Now, when you're here in the home state, though, you do want to stay within the network. Because when you stay within the network, you're going to get the best benefits. Now, these plans may or may not include drug coverage. All the plans, though, that we're going to talk about today will automatically have the drugs included in these plans. And the third and final type of plan are called Medicare Advantage plans. And in a Medicare Advantage plan, how it works is that you assign your rights to original Medicare over to a private company. Now, don't let that scare you. This is just how it works in the back end. From a consumer, all you're saying is that I want to run my medical bills and everything through my carrier. Okay? But on the back end, what's happening is that you're telling Medicare that you're also going to run your bills directly through that private company. So whether it's Part A services or Part B services, and if you have prescription drugs, they lump that all into one. Okay? So what happens is Medicare says, great, we don't have to pay any of your bills. So when you think about Medicare, if you didn't have any insurance, remember they're on the hook for about 80% of your claims, right? In this situation, you're saying, I'm not going to run them through you, Medicare. I'm going to run these directly through the private company. When that happens, that private company gets money, a subsidy somewhat, from Medicare because they're managing your risk, and Medicare no longer has to for that year. Now, you're not locked into this option for forever. You do have the option to go back whenever, a couple times a year and make changes. So don't let that scare you. It's just a little different. How it works is now you would only have one card to worry about, that private company's card. So the carriers that we're going to talk more in detail about the Medicare Advantage plans that we have today are going to be both UCare and Humana. So those carriers are going to talk about how their plans are Medicare Advantage. Now, it's always recommended you stay in the network, especially if you're on a Medicare Advantage plan. Because remember, you're not really using Medicare as the backup here. You're running everything through that private company. So it's important to know, though, within any structure, when you buy additional insurance, you always have the safety net to know that emergency services are going to be covered no matter where you are. Okay. In the United States, no matter where you are, if it's an emergency, you're going to be covered. And you're going to be covered just as if you're at home inside the network. Okay? It's the additional care. You know, if you're just not feeling well and you're on vacation, that may not be considered an emergency. So what you want to do is make sure you understand how your insurance would cover you. It can be important if you're a snowbird, right? If you're gone for not half, but if you're gone for 4 months of the year, right? You want to make sure you understand how your insurance works. These plans, these Medicare Advantage plans, usually include the prescription drugs as well. And all the plans that we're going to talk about today, once again, do have those built in. So that's kind of an overview about the three types of plans. We talked about Medicare supplements, we talked about Medicare cost plans, and we talked about Medicare Advantage plans. Now we're in the most trickiest things to understand with Medicare is the donut hole. Right? It's also known as the coverage gap. So it's important to know about the donut hole is that this is a calculation that resets every year. So the calculation runs calendar year, January 1 through December 31st. Now, if you're new to Medicare for the new year, it's going to start when you start Medicare. So if you start Medicare in July, your donut hole calculation will run July 1st through December 31st, and then it'll reset back to the calendar year. So what the donut hole is it's really a time when the cost of your prescription drugs or your out-of-pocket cost towards your prescription drugs increases. Now, when we think of the donut hole, you really want to think of drugs that you pick up at your pharmacy. Okay? If a drug's administered to you by a doctor in the doctor's office, that usually falls underneath the medical side of Medicare, that Part B that we briefly talked about. Okay? So that's covered under Medicare. That goes towards your out-of-pocket maximum, your worst-case scenario. But if it's a drug you pick up at your own pharmacy, that doesn't go towards that out-of-pocket maximum. So the drugs you pick up at your pharmacy go towards this thing called the donut hole. Okay? Now the donut hole consists of 3 different stages. Now in the first stage of the donut hole, you just pay your deductible and any kind of co-pays that you would have for whatever insurance you choose. So you just pay the deductible and any kind of co-pays. What's happening in the back end is Medicare is keeping track of what you've paid towards your co-pays and towards your deductible, and they're also keeping track of what the insurance company has paid. So when they take what you paid plus what the insurance company paid, and they add those together, that's really the full cost of those drugs. Okay? So in stage 1, you continue to pay your copays until the full cost of your drugs, again, what you paid in copays plus what the insurance company pays, until that reaches $3,750. When that price reaches $3,750, you leave the comfort of having copays and you enter into the donut hole. And that's known as stage 2, or the coverage gap. Now, in the donut hole, Medicare could care less what the total cost of your drugs were at that point. All they care about is what you paid out of your pocket. In order to leave the donut hole, what they're requiring now is that you pay the majority cost of your medications. And you keep paying out of your pocket until you pay $5,000. Once you reach $5,000, then the insurance turns back on. You reach stage 3, and in stage 3 is called the catastrophic stage. And in this stage, what happens is that your insurance turns back on, and now you're paying 5% of the remaining cost of your medications. Now, I think it's easiest if we look at an example, or I'll tell you an example. Let's say that I'm on a drug, and the total cost of that drug is $1,000. Okay? But let's say I have great insurance, and the insurance only charges me a $100 copay for that drug. I'm going to enter the donut hole roughly month 4, because the total cost of my drug at $1,000 exceeds that $3,750 during month 4. Now, in month 4, that's what got me into the donut hole, where the insurance basically turns off. But in month 4, they don't care about what the total cost of my drugs are anymore. They only care about what I paid. So in my example, I only paid $100 copay for those 4 months. So it took me 4 months to get into the donut hole based on the full cost of the drugs. But now that I'm in it, I only have a $400 credit towards my requirement of $5,000. So now in order to leave the donut hole, I have to pay quite a bit more, $4,600 out of my pocket, in order to leave the donut hole where my insurance turns back on. That's how the donut hole works. Now, what I will tell you is that the government is trying to close this gap by the year 2020, and they've instituted some discount plans. So now if you do find yourself in the donut hole, you will not have to pay 100% of the cost of your drugs. These discounts increase every year up until the year 2020, when the donut hole should be closed. So what these discounts for the new year are, is that if you're on a generic drug and you find yourself in the donut hole, you'll only pay 44% of the cost of the drug. Or if you're in a brand name drug, they will only charge you 35% of the cost. Now, it's also important to know that you're going to get the majority cost of your drugs in the donut hole to go towards that $5,000, even though you only paid a percentage, a smaller percentage. So they're going to give you credit as if you paid almost the entire thing. So it's going to allow you to leave the donut hole earlier so that the insurance turns back on. Now, another important thing about the donut hole is that you don't have to be a mathematician to figure this out. Your carriers have to supply you, your prescription drug carrier has to supply you with a report that's going to show you exactly where you are, whether you're in stage 1, stage 2, stage 3. Okay, so you will receive that information. It's also important to know that you really want to make sure your drugs are covered under the carrier's formulary. Because if you're on a medication that your carrier doesn't cover, it doesn't go towards that donut hole calculation. You're paying the entire cost of the drug for the entire year. So when I talk to people, the most important thing to know is if you're on a lot of drugs or expensive drugs, you really want to dial into the plan that's best for your needs and make sure that your drugs are on the carrier's formulary that you end up choosing. So here's what I feel is one of the most important slides in my presentation. Now what? We have a little bit of information about the A's, B's, C's, and D's in Medicare. But now what do I do? How do I pick a plan? So here's some tips on different things that I feel you should look for when you're choosing a plan. I just mentioned the donut hole. Number 1, you want to take a look at each carrier's formulary. How does that formulary compare to your drugs? Do they cover all of the drugs? How are they covered? Do I pay a copay, a flat determined amount? Or do I pay a co-insurance, which is a percentage of the total cost of the drug? You also want to look at the out-of-pocket costs on the medical side. Remember, that's your safety net. In the worst case scenario, if I have a really, really tough year on my medical side, if I go to the doctor a lot, what's the most I'm going to have to pay? And that's what the out-of-pocket maximum is. Then you also want to evaluate the networks. Where can you go to the doctor? Do you have the flexibility to be able to see the doctor that you want, the specialist that you want? And by the way, does it travel with you? If you are gone for long periods of time, 3-4 months, and you want to make sure that you have care where you go, is the plan going to travel with you? Now, security, trust, and brand equity. What I mentioned here is it's really important to choose a reputable company. On the medical side, I would consider the majority of the plans here to be reputable. Not necessarily all plans here today they'll be talking are definitely reputable. I'm talking more about in the marketplace in general. On the prescription drug side, there are carriers that we see here 1 year and gone the next. So you really want to be a little bit careful to understand, is this a good reputable company? And to make sure you do your homework on which ones are. Now, I can tell you that Education Minnesota, we've vetted these insurance companies, and we're very proud of the ones that we work with, and we believe in their products. And lastly, service and communication. Now, you're going to get a lot of recommendations from your friends, right? When you're having coffee, when you're having breakfast, and they're going to feel very strongly. There's always that 1 or 2 people that are going to step up and say, you've got to buy this plan. It's the best one that's out there. That's going to happen. But here's what I'll tell you. This is truly an individual analysis. I mean, if you're husband and wife, you may be on 2 completely separate plans. Because it's not very often you're going to have the exact same medical needs as your spouse. Right? I always say if I was on the same medications my wife was on, I would look different. That's how it would be. So my point is that you really want to make sure you're picking the best plan for you. Because one little medication that one of you's on can cause a world of difference in the recommendations as to which plan's best for you. So that being said, what I'll do is I will turn over for some questions, and then I will transition to the other providers.